And thanks for joining us. Charlotte is off tonight. UW-Madison researchers are testing volunteers for COVID-19 with a new saliva test, hoping to increase the frequency of testing and the speed of results in our community. Madeline O'Neill tells us how the more simple test could help bring people back to work and school safely. Maddie?
Well, teams are testing volunteers at 3 sites on campus, along with staff at a local elementary school, as well as hoping to expand that testing to children and players and coaches at UW athletic facilities. Now, this test is non-diagnostic, meaning if you test positive, it's a good indicator that you have COVID-19, but you'll still want to get that confirmed. Still, researchers hope that this can help screen people who may not know they're sick.
If you had told me a year ago that we would be testing for a novel, potentially fatal coronavirus behind a bike shed in 2020, I would have thought that that would be absolutely bonkers.
But that's where husband and wife Dave and Shelby O'Connor find themselves as part of UW-Madison's pathology and lab medicine department, now at mobile sites, taking saliva samples from volunteers.
We're spitting into little, we call pointy straws, which are pipette tips.
It's called an RT lamp test. Basically, instead of using specialized instrumentation like those done at hospitals and the Alliant Energy Center, it's a simpler process with results showing as a color change in a test tube a couple hours later.
But it is a little bit more of a simple type of test that we can train non-scientists to do, and that would be the point. And if you can do this on site in a workplace, you would also be able to get those test results back quickly to individuals.
Senior scientist Dawn Dudley helped adapt the test to use saliva, easier on patients than the swab test.
For frequent testing, the saliva is really the way to go.
Researchers say more frequent testing like this, perhaps twice a week, would mean a better chance of detecting the virus, especially among the most contagious.
Testing like this will hopefully be able to identify them more quickly because you can test more people, you can do it more quickly, and you can find the people who are at greatest risk.
While this testing is still in the research phase, scientists say it has the potential to help bring people back to work and school safely, as long as more work is done first.
We can't get to that point until the community cases have been driven down.
While this type of testing isn't as accurate as the diagnostic testing, researchers tell me it will detect the virus in the most contagious of patients who can be connected with the most community spread. And a Madison-based company is working to make this type of testing more accurate.
Madeline O'Neill reporting. I'm Maddie. Thank you.